Let's talk about Vioxx and the problems surrounding that drug in this video. I've got an article here from the Seattle Times. I make these videos to share knowledge and information with people who may not, you may not know about the long history of fraudulent, misleading claims by the pharmaceutical industry and the problems they've created. Vioxx was one problem. The opioid problem was another problem. More people are probably more familiar with that one than Vioxx. Even I am, researching more. I'm learning more and more all the time, and I hope you learned something in this video. If you do, please leave me a thumbs up. I would appreciate it. Vioxx makers knew of drugs' dangers 3 years before recall, says UW study. This is an article from 2008, originally published in 2008. See, this is a very old problem. People have short memories, and it is very scary to see people not remembering how much damage these drug companies and pharmaceutical companies have done to America and human beings. Let's jump in. The maker of the controversial arthritis drug Vioxx knew of its dangers for as long as 3 years before a massive nationwide recall, but withheld the information and played down the number of deaths associated with the pain medication, according to an analysis published today by University of Washington professors. The maker of the controversial arthritis drug Vioxx knew of dangers associated with it for as many as 3 years before a massive nationwide recall, but withheld the information from federal officials and played down the number of deaths associated with the pain medication, according to an analysis. Okay, so that's what we just read. The article, which appears today in the prominent Journal of the American Medical Association, which is wild to me because they all seem to be in cahoots, especially when you look at what happened in 2020, the complete scam of 2020. The journal contends that Merck, which pulled Vioxx from the market in 2004, knew internally as early as 2001 that people at risk of Alzheimer's disease also were enrolled in 2 Vioxx clinical trials were dying at 3 times the rate of those taking a placebo. That's weird because I thought they said it was a pain medication. Let's keep going. The article, which examined previously secret Merck documents, contends the company switched calculations to minimize the number of deaths. Shocker. A Merck attorney, Jim Fitzpatrick of New York, countered today that the company disclosed all its clinical results thoroughly and that we completely disagree with allegations that Merck misrepresented its findings. The article is one of 2 papers in this week's issue of JAMA, investigating the clash of corporate interests and scientific integrity involving Vioxx, the subject of the most expensive drug recall in history. That is wild. And people wonder why some of us are skeptical of the science and can't follow the science. This is why. They have destroyed the trust in Americans, and it was mind-boggling that many Americans looked at those of us who knew these companies and knew something, not only know the drug companies, but know the government. Sketchy AF. In an accompanying editorial, JAMA's top editor called for drastic actions against corporate manipulation of clinical research and the practice of ghostwriting medical articles by unnamed authors on corporate payroll. See, there it is. There it is. When you know, you know. Spread this information to someone who doesn't know, who trusts pharma and the gov. You might do them a large service, my friends. It argues that researchers, regulators, and even editors of medical journals such as JAMA are complicit. I would agree with that based on what I know. Once the system gets its grubby little hands on everyone and starts buying them off with money, it is very hard to get the truth. It singled out doctors who lend their names as authors on research papers for money for behavior, quote, that is unprofessional and demeaning of the medical profession, just like we saw in 2021. Total, complete bullshit. Both the article by UW professors and the companion paper on hidden authorship of articles on clinical trials rely on documents disclosed through some of the 27,000 Vioxx lawsuits against Merck. In November, the New Jersey company agreed to settle a majority of those suits for $4.85 billion without admitting guilt. See? sketchy. The co-author of the UW paper, Richard Cronmall, professor of statistics at UW, is a paid expert witness for Vioxx plaintiffs. The lead author is Bruce Satie, UW professor of medicine. Vioxx is a prescription arthritis drug and painkiller that was promoted as a gentler alternative to other drugs such as aspirin. Merck withdrew it in September 2004 after disclosing that a study found it doubled the risk of heart attacks and strokes. See, that's the kind of bullshit you got to ask yourself. Well, how in the F did a drug like that get on the market? Well, we know how it got on the market. Money, 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 money. It's bullshit. But information was available well before 2004 that showed that Vioxx posed serious potential harm to subjects in clinical trials. As early as June 2000, unpublished data submitted to the Food and Drug Administration showed that taking Vioxx significantly raised the rate of heart attacks and strokes, as well as edema and hypertension, according to subsequent analysis by independent researchers. Excuse me. Some of the same early, so let's revisit that. So as early as 2000, unpublished data submitted to the FDA. See, I don't know what that really means, but did they know? Did they know too? Some of the same early evidence prompted pharmacists from Seattle's Group Health Cooperative to decide against adding Vioxx to its formulary. As a result, Group Health has never covered Vioxx for its members, said Jim Carlson, the co-op's director of pharmacy. Good for them. In the latest JAMA article, the UW researchers compared internal Merck memos about 2 Vioxx studies involving patients at risk of dementia against information the company submitted to the FDA and published later in 2 clinical trials. In April 2001, a Merck statistician concluded that 34 people in the Vioxx groups had died compared with 12 in the placebo groups. But in its submission, frog in my throat today, but in its submission to the FDA 3 months later, Merck used different methods to reduce the mortality risk, coming up with 29 deaths among Vioxx takers and 17 in the placebo groups. Wow. Merck apparently did this in part by omitting some of the deaths that occurred after the subject had stopped taking the drug, said Satie. They were not being forthright, he said in an interview today. They minimized the appearance of risk. All right, that's the article. I'm going to do another one here, so check it out on my YouTube channel. Leave me a thumbs up if you like this video. Share it with someone who needs to know this. Maybe someone who is buying the BS that these guys have your best interest at heart. Remember, also direct them to the Wikipedia page that lists the extensive list of federal fines from the Department of Justice to these pharma manufacturers in the billions of dollars. It is very eye-opening. Thank you very much. Have an awesome night, and I will talk to you in the next one. All the best, health, wealth, and success. Bye-bye.